Unfortunately, West Virginia is losing nurse practitioners to surrounding states who are keeping pace with the laws that welcome and support their expanding scope of practice. Creating legislation that allows nurse practitioners to fully function independently will encourage them to stay in West Virginia, thus creating more access to primary care in our rural state. Increasingly, school nurses and primary care nurse practitioners are developing school-based clinics where families and students can access primary care close to home. In this way, health issues can be prevented and detected early. There continues to be a great demand for nursing services outside the hospital setting, and this will continue as baby boomers age. According to AARP, home-based long-term care is preferred by most people and costs half as much as residential nursing home settings. Clearly, money invested early in health promotion, wellness, screening, primary and chronic care, all functions provided by nurses, can create huge savings in reducing the need for specialized inpatient care and technology. Healthcare reform calls for increased coordination and appropriate utilization of a wide range of health providers and resources. Nurses at the BSN level and above would be ideal coordinators of care in the proposed medical home concept, which calls for centralized health promotion, primary and chronic care in a community-based, multidisciplinary healthcare setting. Nurses are health and person versus disease focused. Nurses are educated to assess appropriate levels of care and make cost-effective referrals to the right level of care at the right time and coordinate care on a long-term basis. Nurses have a multidisciplinary education, making them ideal health team coordinators of care, who capably coordinate, collaborate, develop, and utilize resources cost-effectively. More and more, the public turns to nurses to navigate an increasingly complex healthcare system. Gallup polls consistently report nurses rank number one with the public in both the most ethical and most trusted profession. Nurses are frequently consulted by family, friends, and neighbors about health information and what course of action to take before consulting a physician. New nursing services are currently being provided by nurse navigators, phone line nurses, and nurse advocates, and other roles are being developed to meet the increasing demand for personalized information and decision-making in an increasingly complex community-based healthcare environment. At the same time, the average age of nurses working outside of the hospital setting is older than nurses working in acute care settings. New nursing roles are providing an opportunity for experienced nurses to continue to provide services to the people who need them as they themselves age. The West Virginia Nurses Association wants you to know we are leaders and partners with you in health reform. We don't know yet what our roles will look like in the future. So we have a suggestion to simplify your development of health reform legislation. Nurses always practice within their legally documented scope of practice, whether it's school nurses, nurse midwives, advanced practice nurses, or maybe some new role that we develop. Simply including the phrase, nurses performing within their scope of practice, or primary care providers performing within their scope of practice, anywhere you currently see the term physician, will allow for the increasing innovation, expansion, and collaboration of healthcare providers so that we can provide seamless, cost-effective care to West Virginians through the lifespan from birth to the end of life. As the voice of all nurses in West Virginia, the West Virginia Nurses Association wants you to know you can call on us to provide you with cutting-edge information regarding the impact and need for change, connect you with your constituent nurse leaders, support your proactive legislative initiatives, and continue to advocate for the health of all the citizens of West Virginia. Thank you for allowing us to share our views with you. The nurses of West Virginia appreciate this opportunity to partner with you in our mutual dedication to West Virginia health reform.